Hypertension. Basic principle. Increased blood pressure may involve pulmonary or systemic circulation. Systemic hypertension is defined as pressure greater than 140 over 90 mm of Hg. 140 is systolic blood pressure and 90 is diastolic blood pressure. But normal blood pressure is less or equal to 120 over 80 mm of Hg. Hypertension is divided into primary or secondary type based on etiology. Primary hypertension. Hypertension of unknown etiology 95% of cases. Risk factor include age, race, increased risk in African American, decreased risk in Asian, obesity, stress, lack of physical activity, and high salt diet. Secondary hypertension. Hypertension due to unidentifiable etiology 5% of cases. Renal artery stenosis is the most common cause, such as a renovesicular hypertension. Stenosis decreases blood flow to the glomerulus. Juxtaglomerular apparatus respond by secreting renin, which convert angiotensinogen to angiotensin 1. Angiotensin 1 is converted to angiotensin 2 by angiotensin converting enzyme. Angiotensin 2 rise blood pressure by contracting arterial smooth muscle, increasing total peripheral resistance. Promoting adrenal release of aldosterone, which increase resorption of sodium in the distal convoluted tubule and expanding plasma volume. Lead to hypertension with increased plasma renin and unilateral atrophy due to low blood flow of the affected kidney. Neither feature is seen in primary hypertension. Important causes of stenosis include atherosclerosis in elderly male and fibromuscular dysplasia in young females. Fibromuscular dysplasia is a developmental defect of blood vessel wall, resulting in irregular thickening of large and medium-sized arteries, especially the renal artery. Benign and malignant hypertension. Hypertension can also be classified as benign or malignant. Benign hypertension is a mild or moderate elevation in blood pressure. Most cases of hypertension are benign. Clinically silent, vessel and organ are damaged slowly over time. Malignant hypertension is severe elevation in blood pressure, in which systolic blood pressure is greater than 200 and diastolic blood pressure is greater than 120 mm of Hg. Comprises less than 5% of cases. May arise from pre-existing benign hypertension or de novo. Present with acute end organ damage. For example, acute renal failure, headache, and papilloedema, and is a medical emergency.